Hello, everybody. This is the second video for Lecture 3. I am your instructor, Mrs. Frazier, Introduction to Public Health. I hope you can hear me okay. This is a pre-recording I am doing for you guys for the class. So I hope you all had a great weekend. I wanted to split up the lectures just to break it up a little bit. So because they're a little bit shorter, I want them to be shorter versus long and then drag it on. Okay, so we're going to jump back into 12. The last video I kind of showed you, I'm going to share my screen here. Kind of showed you a little bit about this week coming up. Again, I hope you all had a safe weekend and looking forward to this week. Make sure you jump on Module 3 this week. I have the page here of what you need to be doing, your to-do list, okay, and then where your PowerPoints and everything that you'll need. Of course, there's links, but again, it'll be on the module section. Okay, so make sure you're reading the chapters. I'm skimming through the lecture, but I want you to make sure you're reading the chapters, okay? So chapter 12, genetic diseases and other inborn errors by genetics, from genetics. And so let's talk more about that. Infectious pathogens to be aware of, pterogonins, environmental. So we kind of just want to pay attention to these environmental chemicals, drugs, alcohol, cocaine, and heroin. So these I want you to be aware of where they come from. These are issues that we have in public health that affect our genetics and passing it on to our children. And so I just want to be aware of those, okay? All right, genetic diseases, chromosomal abnormalities, sorry, I can't talk, and then other genetic issues, genetic recessive gene, the dominant gene, and the X-link. Just be aware of those, aware of the genetic diseases that are that happen, okay? So new mutations that cause genetic diseases, this just happens. It's just what we are given with our genetic disposition. But again, it's what we have, and we have to work with what we got. Genes influence adulthood diseases. They have seen this. Mental disorders believed to be genetic as well. I also have worked in mental health, and I have seen this where their mother on the mother's side and on the father's side both have mental disorders, depression, bipolar, and more. And so it's just, and another thing it is passed on, but to look at it as, okay, let's move on, let's move forward, work with this on ways to move past it. Even though this is your genetic disposition, what are ways to move forward, how to help patients through this, to understand these dispositions and things like that, what supplements they can take to help while they're pregnant, and other things like that, ways to improve on, okay? So now we have newborn screening, which has advanced so much. There's a public health mandate preventing death and disability from many genetic diseases. They do test drops of blood from newborns to see about their metabolic abnormalities. So there's a lot more screening done, which is so important, especially when infants are just born. Also, early diagnosis can prevent or reduce permanent damage. And the CDC recommends screening for profound hearing loss. So all of these tests, multiple tests are done when an infant is born and pre and before. You know, there's so much more better screening now than there was before, okay? Carrier screening, so these are done to high-risk populations. These are done for high-risk populations. So if they have these, you know, when they fill out the forms and things like that, they have screening for these diseases, okay, genetic dispositions. Okay, prenatal diagnosis, this is done beforehand, and options for mothers, parents, both parents, and what to do, okay, and how to be prepared. Okay. Guidelines for genetic screening. Screen newborns only when it's clear. Benefits the newborn diagnosis can be confirmed when treatment and follow-up are available. Carrier identification should be voluntary and confidential. Include education and counseling with prenatal diagnosis. Tests should be high quality, FDA evaluated. Um, and it provide more genetic education to the public. That's why we're doing it, just to prepare people for what may happen. And I'll do a activity for you guys to look at for this chapter. I like to make sure to each chapter you kind of have an idea because they're so short. Okay, so I will post this on Canvas. Now let's jump to chapter 13. I'm telling you, very short chapters. Okay. All right, do people choose their own health? Okay, so leading cause, actual cause of death, genetic, poor diet, physical activity, alcohol consumption, toxic agents, motor vehicles, firearms, sexual behavior, and drug use. So these are actual causes of death. Microbial agents, things like that, could cause onset death, early mortality rate. Um, they actually account for half of all the deaths. Most are preventable, most are premature, most are caused by individual behavior. Though these target for public health interventions, education is key for these, especially diet and lifestyle, education on why tobacco is not good for you, cigarettes, vaping, things like that, where, yeah, it's an addiction, but how can you get through it? And do you know this actually decreases your life expectancy? Okay. Tobacco is the leading actual cause of death in the United States. Causes cancer, cardiovascular disease, which we talked in chapter 11, chronic obstructive lung disease. I see pulmonary patients, and I see this, number one, and they still smoke, where they're wearing an oxygen machine. They're trying to get through pulmonary rehab, and it's just so hard. They struggle from going from one place to another, or just getting up to go to the bathroom, or just getting up to go to a very close range. It's difficult. Okay. Infant deaths due to low birth weight, burns to accidental fires. So this is a big one. Tobacco use. Okay. Poor diet and physical activity. The second most important actual cause of death. I have met, so that's why I'm a dietitian. I'm here to educate. I am here to just make it simpler. I know food is very essential. Obviously, we know that, but how important it is to just feed our bodies with good food, good quality food, and food that's going to help our bodies, not hurt our bodies. And understanding how being at a not an unhealthy weight and puts risk for heart disease, stroke, diabetes, and cancer. It just puts more strain on your body. And to incorporate better nutrition the right way, it's very preventable. Activity, just getting up. That's why I ask patients, how much time do you sit during the day? And I get pretty much all day long, especially with being in the house. It's hard. But again, you can try to clean and move and always try to make sure within that hour to get up every 30 minutes or so. Okay, misuse of alcohol, motorcycle vehicle fatalities, chronic liver disease and cirrhosis, home injuries, drownings, fire fatalities, job injuries, cancer, underage drinking. So this has been a huge one, an impact on public health with alcohol misuse. And so just understanding what the cause of it, what these areas have done with just alcohol abuse. Okay. Microbial agents are the fourth leading cause of death, encompasses the third killers of the 1900s, have no means being conquered, move to a higher position of the list in the future. So this has just been ongoing since the early 1900s. Unfortunately, we're trying to figure it out. But again, you know, it's time, like anything else. Toxic agents, fifth leading cause. The fact that toxic agents are only listed fifth is evidence of successes in environmental health, improving our environmental health, recycling. Try to use, our just the environment, better cars, not a lot of gasoline, smart cars, drive only certain times you need to, um, you know, better air quality. And we're working on that, but paying attention to what environmental health is and just doing our part. Okay, public health interventions, education, regulation, prohibition. So these are big things that we've struggled in public health to try to educate, try to regulate, and try to just get people to be aware. Okay, this is what is the cause of your death, or not cause of death, not your death, because we don't know when people are dying, but be aware of, okay, this can be preventable. Okay, education informs the public about healthy and unhealthy behaviors, ways of an outlet, smoking bad effects, recommended dietary allowances. We try to do the best we can to help our community, to educate our community, but it's the community that has to listen and be open to this, right? Effective approaches, health education in schools, sex education is so controversial, insensitive. We have to be sensitive of everything that we teach, every word that we say, but we're trying to educate the proper tools, the proper education. And so some people, it is sensitive. It is, and so we have to be aware of that, but also understand we need to educate. If we didn't educate, we would have a big problem, and we're already having a big problem with people not being open to, okay, tell me what I need to know, tell me what the resources that I need. And for everybody that's taking this class, I am very proud of them, because you want to learn what's going on, you want to understand more of public health, and you're going into healthcare. Okay, we've lost a lot of healthcare workers and people going out of healthcare system just because of what has been going on. So we need more good healthcare workers. We need more people going into the healthcare field, and just have a passion for it. And so I appreciate all of you guys being in this class and wanting to learn, and taking that initiative of, yes, I want to understand more. Okay, that's the first step, especially improving your education, improving yourself. So you're on the right track. Okay. Regulation is intent to restrain people from harming others. Public health laws are there to help to keep people safe. Traffic regulations, restriction on alcohol, drugs, tobacco, laws to prevent minors from unhealthy behaviors, requiring vaccinations, things like that. Behaviors and hard to regulate, screening for STDs. These are hard. These are hard, especially for the public. But again, we have these in place for a reason. Okay, there's always a reason for it. And sometimes it's hard to understand, but other times it's trying to help the public to keep us safe, and keep us structured. Okay. Prohibition against drugs such as heroin, marijuana, cocaine is generally accepted. The war on drugs may not be working. It is expensive, empowers criminals at home and terrorists abroad. It sends thousands to prison for minor offenses. The 18th Amendment was banned. Alcohol was effective in reducing disease caused by alcohol. So just being aware of this, you guys, understanding it, just having an understanding. Okay, nobody's perfect, but again, we want to try to have understanding if this can affect our lives, our families' lives, our friends' lives, our community. Okay. All right, these are just questions. You don't have to answer them. I put activities for you guys to do, but it's just for your guys's own resource. Okay, now we're jumping to Chapter 14, how psychosocial factors affect health behavior. This is huge. So behavior and social environment, most important predictor of health is social economic status. There we go. Okay. Health holds a lot of levels of social scale. Health is also affected by gender, marital status, race, ethnicity, and more. U.S. racial and ethnic minorities have poorer health than whites. Health disparities are a big concern of public health. We're seeing this right now. And unfortunately, all we can do is just educate. All we can do is speak our minds. All we can do is help each other and listen. Okay. And all we need to do is just love each other, and just respect each other. I think that's the biggest thing too, and hear each other. And so right now we're struggling with this. Okay. Why the effect of SES? Nutrition, sanitation, conditions of physical environment, levels of health behavior, access to medical care, the right medical care, psychological factors, stress, mortality increases after death of a spouse, loss of a job, divorce, a pandemic, increased risk of heart disease and common cold, social support. This is huge. And if we don't have this, I've had so many patients right now, they live alone and they feel isolated. And it's so hard because if you don't have that support, your mortality rate increases. Okay. Psychological modules of health behavior, health belief model, very important. The classic frame of reference for understanding health behavior, especially health behavior change. I am vulnerable to threat. The threat is serious. By taking action, I can protect myself. So understanding the health belief model, self-efficiency is a sense of controlling over one's life, increased previous successful performance, learned helplessness is a pattern of numbered acceptance of a negative solution. So understanding a behavior, and we're figuring a way to change that behavior. When you see patients, I want to quit smoking. Okay, where are they at? Do they want to quit smoking? Have they tried quitting smoking? What have they done? And then what happens when they didn't quit smoking and they're still here, and they have COPD. Psychological models of health behavior. So this other model, it helps understanding pre-contemplation, contemplation, preparation, action, and maintenance. So this is how I assess a patient to see where they're at in health behavior change. Understanding, okay, maybe they're preparing you, they get to a point of they've tried, they looked up research, they've started putting certain things in action. Okay, this is a big step. But pre-contemplating, thinking about it, maybe I do want to make the change. Contemplation, it's in the mind, it's starting to process a little bit more. Preparation, starting to put something into action. Okay. Okay, so this tells different levels, module of behavior, different ways how we think, interpersonal level, psychology, school, workplace, community, public policy level. So these all put a factor in how we understand health behavior, how people behave, how people handle situations is based on all these different levels of interpersonal level. Okay, example of health promotion programs, AIDS prevention targets different levels of influence, interpersonal level, peers, support new behavior. So this has just been done to help support people with AIDS or HIV, because it's a very sensitive thing, and having a good community to have support really helps this area of population. Community level education programs for bartenders in gay establishments, distribution of condoms, public policy level free confidential testing, things like that. Okay, changes in the environment is more effective than trying to change individual behavior. Changes focused from blaming the victim, was pioneered in injury control programs, effectiveness of tobacco control programs, consider improving diet and decrease. Decreasing physical inactivity. So improving quality of life, working around and trying to help people get healthier. Okay, and now we're going to jump to 15 here. Okay, see, it's real quick, really quick. All right, public enemy number 1, tobacco. Okay, so again, we've talked about this in chapter 11. Diseases caused by smoking, cardiovascular disease, lung cancer, respiratory diseases. Look at all the respiratory diseases that happen. Cancers, diseases among infants and burns. So smoking, this is just a variety of how you smoke. Vaping is part of this, you guys. So understanding that as well, they're showing to have a negative impact on health. Okay, biomedical, bias of smoking, harmful effects. Nicotine is an addictive drug, raises blood pressure and heart rate, may cause spasms in blood vessels of the heart, and just being aware what the impact does on the heart and the body. Okay, carbon monoxide interferes with oxygen carrying capacity of blood, um, and what it does to the body. Historical trends: intense use began in the early 20th century, and distribution free to soldiers in wars. Women began smoking during and after World War II. Smoking peaked in the mid 1960s, over 42% of adults. Lung cancer trends, smoking trends about 20 years. And Surgeon General first report 1964, smoking rates began to decline. So prevalence, onset of the disease of smoking and cancer, African American men had a higher rate, but it had declined. American Indians and Alaskan Natives have high rates. Strong association with lack of education. Now is US about 14% of adults. Okay, so it's starting to decrease, which is great. Regulatory restrictions, review this. Okay, emphasis on the youth, understanding how our youth needs to be educated and what we can do to help them understand how important it is to stay away from this, what it can do and increase their mortality, increase disease. Taxes, of course, they're taxed. Teenagers especially sensitive to price. California raised cigarette taxes to fund tobacco control programs. Many states have raised cigarette taxes to close budget shortfalls. Okay, tobacco control program funded in the 1989 tax increase, 25 cents per pack. Cigarette consumption immediately declined, which was great. Okay, in 2017 it declined to 11%. So it's there, but still we still have work to do. 1990s broad attack on tobacco. Class action laws by state attorneys general are filed. FDA commissioner proposed to regulate tobacco, linked tobacco company documents, and more. So read on in this chapter. Mastered settlement agreement. Industry agreed to pay $206 billion to 46 states over 25 years. $1.6 billion to American Legacy Foundation. Truth Campaign used lessons from California's campaign. Okay, sorry about the dogs. Okay, so Family Smoking Prevention and Tobacco Control Act was passed in 2009. Authorizes the FDA to regulate tobacco products, to restrict advertisement and promotion. Okay, so read on in that. Electronic cigarettes, according to CDC, between 2010 and 2013, e-cigarettes awareness grew to 80%, more than doubled among the U.S. adults. They're heavily marketed on television. FDA does not have the authority to regulate. So being aware, small children due to fruit and candy flavors. This is a big concern, you guys. This is not helping our future at all. This is increasing more death, more disease. What it does to your lungs. You should see a lung, what a lung looks like. You will if you're going into nursing or in the health field, of what a lung cancer looks like, or someone that has smoked for 20 plus years, or a vapor, somebody that vapes. Okay. All right. So I apologize for the dogs barking in the background. So again, I'll have some activities for you guys to do. I'll have the lectures posted. I will have this video posted. But read and review chapters 11 through 15. I will also post an announcement when we're going to be doing a Zoom meeting this week. It may be Tuesday evening or Wednesday evening, depending on people's schedule and mine, to correlate. And again, it will be recorded. So if you're not able to make it, I will record it. Please do not worry. Please check your announcements, check Canvas. If you're having any issues or concerns, please let me know. Sorry for these short videos. I'm trying to get this set up to help just make sure that you're seeing me. I'm used to doing live versus recorded, so thank you for your patience with me and watching these videos. I appreciate your time, and I hope you all stay safe and well, wear a mask, social distance. I will also keep updating you on COVID-19. I had additional resources. I will post additional ones. Then I'm sorry I haven't had the time to do that. I will do that because you're taking this public health class for a reason. I want you to be educated. I want you to have resources at your fingertips, but being more educated of what's going on. Okay, and that is my job, and I'll work harder to help you understand it better. And please be patient with me because I'm still learning this online thing as well, online learning. But again, I'm doing videos more frequently. I'm getting used to that, and hopefully you can hear me okay. And if not, I'm working on it. Anyhow, please take care and be safe. Again, email me any questions or concerns. If you do need accommodations for these exams, please let me know. It's week 3. You should have told me week 1. Don't be shy or don't hesitate. Okay, I need you to tell me, I need you to communicate with me. That's the biggest thing, especially in online, is communication. Okay, I want you guys to succeed. I want you guys to thrive. I want you guys to do well in this class. Okay, all right, so I will stop sharing my screen. Um, and I hope you all have a great week. Thank you again for your time. And I will talk to you next week. Thank you. Bye bye.